Spine is at the back, right ventricle at the front. With a tricuspid valve, which is on the right, at the front.
Spine কাছে left.
You can see the valves systole and diastole, of course. You can see the mitral valve. If you look carefully, you can see the mitral and tricuspid valves. You can see the leaflets opening and closing to the left ventricles. And this is for a little bit more of an advanced view. Normal, abnormal? You've got a decision to make.
Normal.
Normal, abnormal, or I want more information?
The normal মনে হচ্ছে.
Normal, we've got normal. Because some people asking for more information. I would go for more information. Maybe let's take a little slightly different view, okay? Same patient, different view. This is now the apical view. Normal or abnormal?
Normal.
What is the offset? Look at the crux of the heart. Can you see an offset when that valve is open, when the valve is closed? Maybe it's an ADSD. Can you see here? There is no offset. Can you see the valves? ADSD. No offset. Normal, abnormal, or more information? More information is always useful. Okay, I'll give you more information. Okay, spine is at the back. Right ventricle, that looks okay. Tricuspid valve is on the right. Which valve is nearer the apex? The tricuspid or the mitral? What do you say? Many times we say. The tricuspid valve is on the right, is nearer the apex. Which valve is near the apex here? The mitral valve. So this is incorrect. Okay? The right ventricle. You see? Left ventricle, the mitral valve, tricuspid valve. So what's happening here is that the right ventricle is on the left, and you have reverse offset. I don't need you to work out the exact diagnosis, but I'm pleased that you saw that this was not normal. This was not normal. The final thing we're going to look at, one thing before last we're going to look at the heart is the regular cardiac rhythm. We want to make sure that there's a normal rhythm before changing view. I'm not going to cover today everything is too much. And then finally, we want to make sure that we look outside the heart, there's no pericardium. Now, if we do a perfect four-chamber view, like we've just done, the perfect four-chamber view, we're going to miss a lot of cardiac abnormalities. There's a lot of cardiac abnormalities in the perfectly normal four-chamber view, and it is the vessels that are abnormal. So our next entry point is going to move from the four-chamber view up towards the vessels. We're going to go in segments as we sweep up from the left four-chamber view. We're going to go to the left ventricular outflow tract, the right ventricular outflow tract, three-vessel view, and the three-vessel tracheal view. It's a simple movement. It's a small movement. There's the left ventricular outflow tract. Can you see that? That's the first thing you see as you go from the four-chamber view towards the head of the baby. The first thing that comes out is the aorta. The aorta comes out from the middle of the chest, of the heart of the baby. So there's the left ventricle, aorta leading there, right atrium, right ventricle, beautiful and normal left ventricular outflow tract. And we're going to look at a number of things on this. Okay? The first thing we're going to notice is that there's a continuity between the mitral valve, the intraventricular septum, and the aorta. There's continuity. Can you see this continuity? This line is continuous. Beautiful line. There's a break there. What is that? The VST. Does anybody remember VST? So continuity and beautiful curve. Can you see that curve? It's an angle, it's not straight. It's an angle. You're going to see a case where it's straight. Remember that. When you follow the aorta, what happens to the aorta? Does the aorta divide?
Yeah.
No, the aorta never divides. If the aorta divides, and it's not an aorta. So you see the aorta, you can see it's not divided because it's an aorta. It goes up and then it goes down. Down its curve. There we go. Mitral aortic continuity. In the top hand picture, you can see that. Aorta is within the left ventricle. Beautiful angle, that lovely curve that we were saying with intact ventricular septum. The aorta does not divide. And of course, we're going to look carefully at the aortic valves. Now the picture, again, left ventricular outflow, just for revision. Okay? Left ventricle, that little white line there that you can see is the throat aortic valve. And here you've got the descending aorta on top of the spine. Where's the aorta? Which side? Left ventricle. That's the angle that I was talking about. Can you see those little stars all along? Yeah? So blood comes out of the left atrium into the left ventricle, out of the left ventricle, up the aorta. You've got no little gap between the left ventricle and the right ventricle. That ventricular septum is complete, and you have that beautiful curvature. It's not straight, it's a curve. Okay. Can you see why that curve is important? What's going on the right-hand side there?
It's straight here.
What is this vessel?
Angle.
Left ventricle. What is this vessel? Aorta. What is this vessel? Aorta. What is this aorta doing? Overriding. It's an overriding aorta. Why? Because there's a little defect there, the VSD that's pointed out in the arrow. That's an overriding aorta, classic of tetralogy of Fetal. One of the commonest cardiac abnormalities is tetralogy of Fetal. It's a very common abnormality. Okay, left ventricular outflow tract. Normal or abnormal? Normal or abnormal? Be confident. Abnormal. Fantastic. What is it? Because we are highly educated, we're not just looking for normal or abnormal. You can see that what's going on here is that there's no angle, there's a straight, there's no continuity, and of course, this is tetralogy of Fetal. There's a picture there. Right and left ventricle feeding into that aorta. Overriding aorta. A little bit more difficult, this one. It's a little red box guiding your eyes to what I want you to see. Spine is at the back. It's a real world image, it's not perfect image. So spine is at the back, right atrium, right ventricle, left ventricle. So this is the left ventricle, but the outflow tract, left ventricular outflow tract. What's happening to that aorta as we follow it up? Can you see it dividing? An aorta that divides is not an aorta. What is that? It's the pulmonary artery. Yeah, it's a pulmonary artery coming out from the left ventricle. This is transposition of the artery. Okay? See? Beautiful vessel coming out of the left ventricular outflow tract and goes on and divides. It's no business dividing. The aorta does never divide. Okay. And this is a picture here showing you the left ventricle split actually. From that left ventricle outflow tract, and you can see it's dividing. But also, it's not the right angle, is it? Where's that nice curve that was? Remember that nice curve? So the pulmonary goes that way, and the aorta goes the other way. Okay. Moving up now from the left ventricular outflow tract, going to up. There's a right ventricular outflow tract. Tiny movement of your hand. Always see tiny movement of the hand. The right ventricular outflow tract. The right ventricular outflow tract comes from the right ventricle. There it is. That's the right ventricle up there. That ventricle, little valve. Then what does the pulmonary artery do? It divides beautifully. You can see that the right and left main branch pulmonary arteries. Good. What's that vessel there? What's that round thing there? It's the aorta coming out that way. Remember they're crossing over, right? So it's a cross section through the aorta. Beautiful. Oops. Let's do some revision. Right ventricle. Pulmonary artery. Pulmonary artery dividing into right and left branch pulmonary arteries. Then we have the aorta and the SVC. We're starting to see that three-vessel arrangement that we all know. Descending aorta already on the left side of the spine, coming down. Okay, that's revision time. In your head, what is number one? The right ventricle. Number two, see the little white line there? Pulmonary artery. That's the pulmonary artery, right? Four. What's four? So the line between the right ventricle and that other structure there. What's that other structure there? It's the right atrium, right? Number four is tricuspid. Number five, you can see face on the aortic line. And if you're really good at ultrasound, you can see that it's got three vessels. And of course the pulmonary, dividing there into its branch pulmonary. See these images. Go through your mind all the different structures and see them. Do quality control of your own images. At the end of the day, take half an hour, pick out all your pictures that you've done on that day, and go through them. Label them in your head. Don't get out of them. You will learn so much. Then, of course, as we move up from that view, we then get to the three-vessel trachea view. Okay. Pulmonary artery, aorta, trachea view, okay, then you can see the trachea on that view as well. So we're moving up, left ventricular tract, all the way to the three-vessel. Happy with that? Simple, sweet. Let's do a checklist then on the three-vessel tracheal view. It's a really, really helpful view of the three-vessel. Remember, those PAS or SAP come together. Pulmonary, aorta, superior trachea. In that order, you can see the little trachea, and that's also where you see the aortic isthmus and the ductus arteriosus. We're going to make sure that the course and the size of the pulmonary artery, aorta, and SVC are correct. We're going to see that you get a beautiful, sharp V shape, aortic arch, and ductal arch. Where are they? Which side is this? Which side is this correct compared to the spine?
Left.
The aorta is coming out from the heart, up like that, going down. Always think in 3 dimensions. Okay? Remember, the aorta goes down the left side of the spine. Thymus is present in the front. You do color assessment by Doppler, as we've seen on that previously, and you make sure that you don't have any atypical vessels like left SVC or total anomalous pulmonary venous return. Quick revision. The picture and the label in your head. Number one, at the front of that three-vessel tracheal view, slightly different color, structure, anterior part of the heart, thymus. You're going to look for that, for example, when you're suspecting a fraud. Number two, got the aortic isthmus. What's number three? Here, remember? Three-vessel tracheal. Yeah? Trachea, exactly on that side, and number four, ductus arteriosus. Now we talked about color Doppler. The blood always flows towards the spine. Okay? Here at the top, it will be blue, because the blood flows towards the spine. If you don't change the settings, then the spine is up, it's red. Blood is flowing towards the spine, from the front to the back. Front. Normal or abnormal? Abnormal, good. What is it? Do you have a nice V shape, or is this more like a U shape?
U shape.
It's more like a U shape, right? Fantastic. So the right aortic arch. In the middle of that arch, structure right in the middle of that. Good. Okay, so we've come from four-chamber view to left ventricular outflow tract, right ventricular outflow tract, the three vessel view. Done a simple sweep, but we've covered so much on this short journey. Remember all the little structures, remember all the little clues that we talked about, and try to remember some key things that I think you should remember. That we've covered so much, I'm not going to ask you to remember everything, but remember these key things. Remember that you need to check in the four-chamber view before looking into the heart that you've got normal situs, normal axis. Ventricles should be equal in size and contractility. The situs and the axis are very important. It's easy to miss an absence and abnormal situs. And if you don't have a normal axis, there's a high risk of a cardiac malformation. Remember that the left ventricular outflow tract arises with an angle, that beautiful curve that we see. Remember that the aorta never divides. It never divides. It should never divide. If it's dividing, it's a pulmonary artery. And of course, you always want to look for normal valves. Pulmonary artery, unlike the aorta comes from the center of the heart, belongs right in the heart of the heart. The pulmonary artery is anterior. Pulmonary artery and the aorta, at mid-gestation at least, are of the same size. And the valves are normal and beautiful to see. And always look at the three vessel view. This is a key view. If I could choose one other view other than the four-chamber view to look at, it would be the three vessel view, because it's such an important view. The three vessels should be seen no more and no less. The angle of the two main arteries should be acute, have a beautiful V shape. And of course, the ductus arteriosus and the aortic arch should be to the left of the trachea. The left aortic arch is what is normal, the right aortic arch is normal. Right. Now, Chair, what's the time? We have a live scan, we have a coffee break, and we have some pictures that we could go through or not. How much time do we have?
We want to go through it.
We should proceed with the live scan?
Yes.
Yeah, live scan? Let's do the live scan. But because we can have tea at the same time as the live scan, we'll look at 3 of them. Not many. Left and right side of the heart. Sorry, left and right side of the body. This is abnormal, right? Stomach is on the right.
Stomach is on the right.
What's going to be this structure here? It will be the aorta. This will be the aorta and the iris. The aorta, even though this is abnormal situs, will be